myself. My name is Jyoti Sharma. I am a psychologist and a music therapist. So basically, I'm a counseling psychologist and a music therapist. And now I have around 14 plus years experience. I have a blended work experience. So I started with my corporate and then, got married. And after my child, I came into education and gradually into counseling and gradually into music. So music was something gifted to me, and I pursued BA music, and I'm basically a commerce student, but yes, I have every bit of all the fields. So currently I'm working with different clinics and different population, different age groups, and working as faculty at Council India also. I did my music therapy certificate course from Chennai School of Music Therapy, and I'm still pursuing more music therapy from the same institute, which is PG Diploma. And moving towards the concept. Okay, so can you see a wide definition of music therapy? Okay, so this is what, if I have to talk about, or if I have to include all the aspects of music therapy, this definition would be the ideal one. So this definition is given by World Federation of Music Therapy. All right, so I'm going to simply read this definition, and I'm sure you'll get an idea of it. But yes, I will be explaining each word of it, because every word has got its own meaning here, and that's how all the concepts will be cleared. All right, so professional use of music and its elements as an intervention in medical, educational, and everyday environments with individuals, groups, families, or communities who seek to optimize their quality of life and improve their physical, social, communicative, emotional, intellectual, and spiritual health and well-being. Okay, so is it hard to learn? Is it hard to learn this definition? I think it is. All right, but it's more important to understand the concept, right? So now onwards, we are going to start. We are going to break the definition. Okay. Starting from the first word, that means professional, right? So professional जो सबसे पहला word है. Here we have got two meanings of it. Okay. So the first thing is, the music therapist has to be a professional, means he or she has to be professionally qualified. Okay. Professionally qualified ka matlab, I will be talking in terms of what qualifications we need universally, right? So at a global level, we all see that we see music therapists on all the hospitals and trauma centers or rehabilitation centers all worldwide. But it's not the case in India, isn't it? How many of us know about that? It's a clinical field or anything, right? Generally, people understand that it's the musicians become music therapists, or anybody can do music therapy who sings. So it's not the same thing. So professional use. First thing was the qualification, how you get certified. So one thing is for sure, that you have to have a bachelor's or master's degree in music, right? That means अगर आप लोगों को कोई doubt है that कि music therapist को कोई understanding होनी चाहिए यानी music की, yes, a very good understanding should be there, because आपकी understanding पे ही आपके cases depend करते हैं, how you deal with your therapy sessions. Okay, the second qualification is music therapy, right? Music therapy certification. For that, you have to pursue from a recognized university, a music therapy course from a recognized university. That again, in India, it is still not available, and no recognized course is available as of now from a recognized university. But we see very soon the plan is going to execute. Another thing is, globally, the music therapists are called as board certified music therapist. Okay, board certified music therapist is the designation, right? We call them board certified. Board certified हम यहाँ पे word नहीं use करते, but बाहर foreign countries में ये word बहुत use होता है. So music, talking about the musical elements. तो ये जो प्रोफेशनल है, जो म्यूजिक थेरेपिस्ट है, व्हाट डू दे डू? वो क्या करते हैं? Professional use of music and its elements. Okay, I didn't tell you the second meaning of the professional is there has to be a professional relationship, which eventually means the same thing, that there has to be a relationship, a professional relationship. That means there has to be therapist and the client. तो दो इंसान होने चाहिए, therapist and client, not any personal relation, right? So what did they do? They use music and its elements. So can anybody tell me what is music and its elements, or just focusing on the elements of music? No one?
Then rhythm and scale, rhythm chords, scales,
Yes.
rhythms and beats, and
That is music. बस यही elements है क्या music के?
ये बहुत चीजें हैं.
हाँ, बहुत
Notes
सारी
सुर
चीजें.
है, सबसे important तो सुर है, सबसे important 12 notes of music. And then
Good. So do
harmonizing
you
them.
play any instrument?
Yes. I'm a complete musician. I did sound engineering.
क्या instrument play करते हैं?
I play. I write and compose songs. I play guitar.
You
I'm a
write.
song-
You write songs. You're a songwriter.
Yes.
Wonderful. Okay. And are you also a singer?
Yes, definitely.
Okay. So let's see.
Mhm.
तो मैंने किसको बोला था? आप ही को बोला था ना? सिंगिंग से रिलेटेड कुछ? आपका गला खराब था क्या? Or somebody else?
No, ma'am, it's fine.
अच्छा, okay. All right. So moving forward, music and its elements. हम इंडियन म्यूजिक को तीन तरीके से जानते हैं, तीन एलिमेंट्स जानते हैं, सुर, लय और ताल. So I'm sure everybody knows this. सुर, लय, ताल. कभी ना कभी तो आपने सुना होगा ना, isn't it? So सुर मतलब कि जो स्केल्स हम देते हैं, जो पिच हम यूज करते हैं, सा रे गा मा पा, तो ये सब सुर है. लय इज द टेम्पो. अच्छा, टेम्पो किसका? रिदम का, मतलब ताल का. ताल हर म्यूजिक जो होता है उसमें आप कोई परकशन, मतलब कोई बीट सुन पाए या ना सुन पाए, आपको एक रिदम एलिमेंट मिलेगा, राइट? अगर मैं अजीब दास्तां सॉन्ग बिना गिटार के या बिना किसी इंस्ट्रूमेंट के भी प्ले करूंगी, इवन देन यू विल बी एबल टू डू अ स्नैप, राइट? यू कैन स्नैप, इजंट इट? क्योंकि आपको पता चल रहा है उस सॉन्ग में रिदम है. एवरी म्यूजिक हैज गॉट रिदम. सो म्यूजिक इज कंप्लीट व्हेन वी टॉक अबाउट सुर, लय, ताल. Eventually, Western music may we have more elements. The names are more, so it's more expanded, or you can say there are wide category of the elements of music. For example, dynamic. For example, pitch, melody, rhythm, form, timbre, dynamics, such things. So hardly matters. यहाँ पे हमारे लिए important ये है कि हम म्यूजिक की बेसिक, म्यूजिक थेरेपी में बेसिकली होता क्या है ये समझें, राइट? सो व्हाट अ थेरेपिस्ट इज डूइंग, म्यूजिक थेरेपिस्ट इज यूजिंग द एलिमेंट्स ऑफ म्यूजिक विद द पेशेंट और द क्लाइंट एज एन इंटरवेंशन. अच्छा, अब कौन सी सेटिंग्स में ये होता है? सो वाइडली तीन टाइप की सेटिंग्स में हम बात करते हैं: मेडिकल सेटिंग्स, एजुकेशनल सेटिंग्स एंड एवरीडे एनवायरनमेंट्स. सो मेडिकल सेटिंग्स से आप क्या समझते हैं? व्हाट कुड दैट मेडिकल सेटिंग्स बी? That's an easy question.
Ma'am, hospitals, mental health,
Yes.
psychology places.
Therapy.
So yes, primarily hospitals की हम यहाँ पे बात कर रहे हैं. We can also include the rehab, trauma centers, and majorly we are talking about the hospitals only because आपको ये wings भी वहीं पे मिलेंगे. Then educational settings. Educational settings के example दीजिए.
Schools हो सकते हैं.
Corporates, education.
Corporates में education कैसे?
corporate setting also they play the music and all.
Okay, so here we are talking about educational settings, which means normal schools,
And
of course,
colleges, yeah.
colleges, yes, schools, colleges, and special schools.
Special schools. Yes.
Primarily special schools. Here we are talking about special schools. Right? Because if I talk, अगर मैं आपको हिंदी में एक शब्द बोलूं, जहां मर्ज है वही दवा है, राइट? मतलब हमारी दवाई की वैल्यू कहाँ है, एपैथीज की वैल्यू कहाँ है, जहां पे पेशेंट्स हैं, इजंट इट, या जहां पे कोई प्रॉब्लम है. ओके, द थर्ड कैटेगरी इज एवरीडे एनवायरनमेंट. एवरीडे एनवायरनमेंट में बहुत सारी कम्युनिटी सेटिंग्स आ जाती हैं, मतलब जहां पे आप जैसे ओल्ड एज होम्स हैं. सो वील कवर दैट आल्सो कि कहाँ कहाँ पे ये काम आता है. ओके, टॉकिंग अबाउट किन किन के साथ हम किस किस टाइप से हम म्यूजिक थेरेपी करते हैं. इंडिविजुअल म्यूजिक थेरेपी, ग्रुप म्यूजिक थेरेपी, फैमिली म्यूजिक थेरेपी, कम्युनिटी म्यूजिक थेरेपी, राइट? सो आर यू ऑल एबल टू अंडरस्टैंड? ठीक है, शब्द तो वैसे बहुत सिंपल है, वर्ड्स आर वेरी सिंपल, इट्स जस्ट दैट यू हैव टू रिलेट with this topic, right? So now comes the purpose. What is the purpose of music therapy? To optimize the quality of the life and improve the client on the basis of their physical aspect, social aspect, communication, emotional, intellect, and spiritual health, right? So we call it as, in one word if I say, we call it as salutogenesis process, salutogenesis approach, right? If you can Google it, salutogenesis.
Ma'am, could you spell it?
Yes, I'll just write in chat. Is it okay?
Yes, ma'am.
Oh, my chat is disabled.
Yeah.
Just opening it, ma'am.
Yeah, okay. I think it's not going to everyone. Acha, theek hai, okay. So you can check the chat. Yes.
Yes.
So do you understand? यहाँ पे जितने भी psychology background से related लोग हैं, participants हैं, you all can relate, because यहाँ when you study psychology, you study these these domains in relate, when you relate with the client. जब हम clients का session करते हैं तो वहाँ भी हम physical, social, communication, emotion पे work करते हैं, right? And IQ also. Sometimes we, बच्चों के केस में तो हम IQ के बिना आगे ही नहीं बढ़ते हैं. And yes, we also add, being a therapist, we also add the spiritual aspect and overall health aspect, since it's a clinical field, right? So any doubts in the definition, or am I able to make it clear to you?
Yes, ma'am.
All right, moving forward. So अभी आप जो अपनी slide पे देख पा रहे हैं, these are the areas where music therapists potentially work. So primarily it's hospitals, neuro rehabilitation centers, psychiatric facilities, trauma centers, counseling centers. Yes, we can work with counselors, special schools, old age homes, prisons, community centers, de-addiction centers, private practices. Asha, how many of you think that de-addiction center pe music therapy works? Do you think music therapy can work with them?
Definitely, ma'am, because music calms the mind. So definitely, I think it could work.
It works.
Mm.
Yes. So these are some major areas where, you know, therapists can easily work. Currently, if you see the current scenario of the music therapy or the job market of music therapists, it's something, you know, you have to rely on yourself once you become a music therapist. I founded Music Therapy India three and a half years back now, and I'm working, you know, as a freelancer. I'm doing private practices related to counseling and these things, and I'm empaneled with other clinics. So such things works as of now. And I see down the line, down 5 years down the line, we'll definitely have jobs related to, or a proper career field related to music therapy. Kamya, do you want to ask something?
Yes, ma'am.
Yes.
Actually, ma'am, prison is involved in this,
Yes.
right?
Already,
So,
yes. Tihar jail. Do you know Tihar jail?
yes, ma'am. I wanted to specifically ask about people who do crime, who have some personality disorder, for example, antisocial personality disorder, which is not very curable, so or not easily treated. So how can music help their personality to, change, or how it's going to help society?
Kamya, it's a good question. Just like, you know, we have counselors with prisoners, we have psychiatrists as well. We have all the facilities for, you know, in good jails. We have all the facilities, all kind of, you know, rehabilitation. Then we have de-addiction centers in jail, the prisons, and we have counselors and we have psychiatrists as well. So in some kind of severe or moderate to severe disorders, they are medicated and they go through the process of treatment. Along with that, we complement music therapy, right? It's not only that you are using music therapy for rehabilitation purpose, but of course, since I pre-COVID, I have worked with a psychiatric setting, psychiatric hospital. So I saw that once, you know, पेशेंट का साइकोसिस स्टेट खत्म होता है या फिर सेडक्शन स्टेज खत्म होता है, उसके बाद म्यूजिक थेरेपिस्ट का काम स्टार्ट होता है, राइट? बिकॉज दे आर मोर इनटू द प्रेजेंट टाइम. उससे पहले उनका टाइम स्पेस ओरिएंटेशन खराब हो चुका होता है, राइट? So if you are specifically talking about the disorders, am I able to answer your question, Kamya?
Yes, ma'am. Yes.
Okay.
Actually, ma'am, currently I've done my BA. So what little knowledge I have about personality disorders is that always makes me question, like, always people coming from personality disorders, like, they get a different treatment even legally, so they don't get
So are you working with such clients, Kamya?
no, ma'am, not at all. I have just done my BA. I just like through my professors and all, they have told me about how personality disorder, how antisocial is not very curable. It's very different and difficult.
Yes.
That's
So actually, the seed lies in the childhood. Generally, you know, when we see the personality disorders case, the seed lies in the बचपन, वो जो बचपन गुजरा है, तो there, you know, it's a long process. We need so many sessions. So music therapy work करेगा कि नहीं करेगा? It all depends on, you know, case to case. It's a very client-centered approach. So it's not necessary that it works with everything. So as with all the therapies, isn't it? So as with counseling also, not everybody is good for counselors, isn't it? So just say if you see 70 to 80% success rate hai, but you will see some kind of shortcomings in 20%. Okay, so quickly we'll just cover this slide. Music therapy is evidence-based and observable and measurable. That means the same thing. If you Google music therapy, if you just write music therapy studies, you will find almost all the music therapists are doing some of the other kind of research. And on Google Scholars, you will find so many evidences that shows that music with music with music therapy sessions, the patient, recovered in a better way. So music therapists do not cure anyone, right? It's not something कि दवाई दे दी, music दे दिया और ठीक हो गए. This is never going to happen. But it is a coping strategy, right? It is something that complements the medicine. And in many cases, for example, in my private practice, I'm dealing with the patients where, they are coming from, they are referred from someone like a psychiatrist or someone, a special school teacher. So somebody is referring the case. तो medication या बच्चों की या बड़ों की medication चलती है. So कैसे हमें पता चलता है कि असर हो रहा है, the results are coming. So somewhere they have started coping up with their situations, daily difficulties, and medications are getting reduced. That's how we get to know. And we have a constant cycle of assessment and evaluation. All right, this is the third sentence. The third topic is my favorite because here I'm going to talk about different from healing का क्या मतलब है यहाँ पे. I'm talking about म्यूजिक थेरेपी एंड साउंड हीलिंग. आप सब में से किसको लगता है कि ये दोनों सेम चीजें हैं? अभी तक लगता था ऑनेस्टली साउंड हीलिंग एंड म्यूजिक थेरेपी इज सेम.
मुझे लगता था.
Okay, so I can't see anyone here. I'm feeling that I'm talking to names.
Ma'am, I think they're different because therapy is into music and sound healing includes the Tibetan balls and all, the different frequencies, simple sounds.
Any more differences? This is very basic. This is just an example.
Maybe hypnotherapy, the music healing helps. I mean, I used to think that in hypnotherapy, this music helps in healing.
Hypnotherapy is completely different from this question. We are talking about two things which, generally people get.
I do meditation. Every day with music. Okay, but I think it's different from music therapy.
Yes. So first of all, music therapy is a clinical field, right? Clinical field मतलब कि यहाँ पे ना literally बीमारियों की बात होती है, बीमारियों की बात sound healing में भी होती है, but the procedure of both the things are very different, right? So I will talk about the procedure of music therapy after, talking about sound healing, right? Sound healing is a sound healer is basically using different kind of instruments. Those are primarily not musical instruments but sound instruments, right? आपको क्या लगता है जो वो मंदिर में ऐसे घंटी बजाते हैं ना, अपने पूजा के घर में, अपने घर के अंदर घंटी बजाते हैं. What do you think that घंटी, is it a musical instrument?
No.
See, it's an instrument. Yes, it's a musical instrument, but primarily it's not a something that is creating music, but it is creating sound, right? It's a sound instrument. Bell, it's a bell.
Ma'am, is sound healing used for children with special needs?
Yes, people do, but primarily I've seen sound healers working with pains.
Oh, all right.
Yes. So we see different type of instruments like Tibetan bowl, as Abhishek correctly said. We see different type of ocean drums. We see storm drums. We see different kind of bells, right? Some kind, where the sounds are getting elongated, sustain karta hai wo sound. And I've seen sound healers working on backaches, arthritis, primarily body physical pains. Now, physical pains can be psychosomatic also. Do you understand psychosomatic? Any kind of pain, physical pain, or physical, any kind of difficulty that is happening because of mind, mental disturbances. Okay, तो किसी टाइप का mental health issue है जिसके कारण body में problem आ रही है, right? उस पे भी work करेगी, but primarily it works on जैसे back pains होते हैं और arthritis हो गया, cervical हो गया. So these you will see sound healers working on these things.
Like migraine.
Migraine, yes, migraine. Such things.
Ma'am, I've got a doubt.
Yes.
Ma'am, if sound healers primarily work on physical pain, and you mentioned psychosomatic, so when we go for a therapy, those pains should eventually go out because it's basically mental problem that we've got, like it's psychological problem that we're actually dealing with. There is no physical problem as such. So why doesn't one go to a therapist rather than a sound healer? And how effective is sound healer for such problems?
See, what I think on ground level, if I'm a layman, I mean, I'm normal person, I don't know about things, but मुझे सबसे पहले जिसके बारे में पता चला मैं वहीं चली जाती हूँ, right? I might not be knowing about music therapy or art therapy or anything. I might be knowing some sound healer, or somebody suggested me to go for sound healing. So I guess ये जो पेन वाला जो एरिया है उसमें साउंड हीलिंग वर्क्स.
ओके,
राइट. बट देन अगर मैं दूसरे पर्सपेक्टिव की बात करूं जो म्यूजिक थेरेपी पर्सपेक्टिव है, अ साउंड हीलर हैज may or may not be qualified, and maybe they are doing out of their experience and practice. Yes, doing under some guru, they are doing these things. But on the other hand, music therapy has got its own practical procedures, right? So on your screen, if you can see, there is a stages hain. There is a process, and that shows that that's how it is a clinical field.
Yes,
it's meant to be a clinical field. We are not only creating music and making our clients happy. That is called entertainment. Right. One more thing I want to know, want to share, or in fact, I want to ask. There are 3 questions I always ask. It's not 3 questions. There are 3 examples I would like to know from you whether it is music therapy or not. Right. I'll give you 3 situations. So first is, okay, let me be the patient or the client. I'm feeling dull and lonely. Mild depression, mild depressed, mild. Or we can say that my mood is not good. And there is a friend. So Abhishek is my friend. And he sings and plays instruments very well. And I thought that let's get rejuvenated and call Abhishek at my place. And I'm sitting in front of him. I'm telling that, yaar, mujhe acha nahi lag raha. I'm not feeling good. Mujhe kuch bhi acha nahi lag raha. Right? And he suddenly starts singing, and suddenly everything gets recreated. So this is one situation. Aapko kya lagta hai? What do you think? Is this yes, and the outcome is I'm feeling cheered up. So what do you think? Is it music therapy?
No.
I think
No.
it's not.
No.
Okay, another situation would be I'm feeling घर पे बैठ के जैसे डिप्रेस से होने लगते हैं ना, वैसा वाला डलनेस आ रहा है. And I have passes for a beautiful pop concert of my favorite pop star. So I decided evening I will go and cheer up my mood. And that's how the plan works. मैं जाती हूँ evening में, and the concert is really great. And then after coming after just finishing the concert, I feel very, very good and rejuvenated and quite active. It worked, isn't it? It worked. So what is it? Is it music therapy?
No, it's not professional.
This one is sound therapy. The earlier one is music therapy.
नहीं, यहाँ पे sound.
No, I don't think the first question and the second example has anything to do with music therapy.
All right, let me give the third situation also. I am a music therapist, and I am also a mother of an infant. and my baby is crying, very cranky, and I took her and on my lap and started singing a lullaby gaya maine, and very soon she got calm and composed. So is it music therapy?
No.
अच्छा, ये नो तो बहुत सारे सुन गए, अब मुझे रीजन सुनना है.
Ma'am,
Ma'am, can I go first?
Yes.
Like explaining my point? I think.
Aishwarya, you are the only one who is unmuted.
Oh, sorry.
Dr. Girdhar. Yeah.
So,
Yeah, it's a
like,
music.
sorry.
Yes, speak up.
Yeah, so like I can see in the screen, process of music therapy has to like start with understanding the problem of the person, right? Like you tend to understand kya problem hai, what sort of assessment does the client need. In all the three situation mein, the first situation particularly, आपका mood खराब था, तो temporarily आपका mood अच्छा हुआ. It was a short term goal. Whereas when we talk about music therapy and when we break down the word music and therapy, therapy is a long process for you to feel better about yourself, right? So in all the three situations, none of it is music therapy per se, because you have to like plan accordingly ki per session kya hoga, how much have you improvised, how much has the client improved throughout these sessions, so and how music therapy is actually working on the client. So based on that we can actually say it's not music therapy in all the three situations.
Yeah, I would say that.
Also, sorry. Also, like it requires a professional help. Like यहाँ पे first पे आपका friend था, then it was a pop concert, and third में even though you as a music therapist, आपने lullabies गाए अपने son या daughter को, so it does not qualify for like a music therapy per se.
ऐश्वर्या, आपको तो म्यूजिक थेरेपी समझ में आ गया है पूरा. So definitely it was over explained, but yes, the last thing you said was the correct answer to these questions. The only thing was missing here was this professional relationship. There is no therapist, no professional relationship to the client. That's why these are not music therapy sessions. But what I want to say is that what is happening here? What is happening here is we see the magic of music. हम बोलते हैं ना music का magic. बोलते हैं ना, what is it? So there is a proper term for it. So therapeutic music, music therapy, therapeutic music, two terms, right? Music therapy is a clinical thing जहाँ पे हम patients के साथ deal करते हैं. But therapeutic music is something we are taking in every day, and every day, we listen to such music. Not everyone. इतनी busy life में हम लोग listening कहाँ कर रहे हैं? We are not listening, isn't it? So तीनों ही case में we use this example for therapeutic music. Therapeutic aspect of music. Music has got its own therapeutic aspect, not for everyone, right? Not for everyone. So one thing is for sure, that the therapist has to work through the client preferences. Okay, so talking about this ladder in the staircase, the first stage is building up a rapport, right? So इससे भी पहले एक stage है जो मैंने पहले cover कर लिया है, which is the referral, right? Referral देना. तो मुझे as a music therapist, I will be getting referrals from the specialists, physician or doctor or surgeon or dentist. These days, dermatologist. Then we have psychologist, psychiatrist, physiotherapist, rehabilitation psychologist, trauma specialist, and whatnot. I mean, yes, prisoner में काम करने वाले counselors भी refer करेंगे. Anybody who is a specialist. So recently I've got I keep getting referrals from special educators of schools. They are not knowing me directly, but they refer to my center. They refer the child to my center because they have diagnosed that this child is, this child needs music therapy. Sometimes to just calm down, sometimes to, work through the concepts also. We do with kids. There are so many sessions, right? So एक जो psychological counseling या किसी भी type की counseling या therapy का जो step होता है, that is the rapport building, right? So the first thing is your music therapy room. So let's not talk about this counselor thing, but only music therapy. Music therapy room should be having a good ambience, very welcoming, ambience, and the environment should be very friendly. And the first and foremost thing is the client should start feeling safe once, he or she reaches your place. So building rapport starts from there only. And then, talking and greeting the client and all those steps that can make your client comfortable comes in building up rapport. Then we have initial assessment and musical assessment. There are two assessments that a music therapist did ideally. So what I'm telling you right now, whatever I'm explaining you, this is not something, Indian made thing, but globally we use this process, right? And it is for every therapy actually. In music therapy, we do an additional assessment called taking the musical profile or musical assessment. So initial assessment may, what do you think, what all aspects are we covering in the assessment? The initial assessment, what do you think?
Ma'am, the conditions of the patient, I mean the problems that we are addressing.
We already have the case history because of the therapist. Oh, sorry, the physician or the doctor has already given me the case history.
Ma'am,
I'm not going to ask those things, right?
can I answer, ma'am?
My client might get disturbed अगर मैं उससे कुछ, पुराना ही पूछने लगूं और greeting वगैरह के बाद सीधा, Yes, Kamya?
Ma'am, maybe as you earlier mentioned that music is not for everybody. So maybe you would assess and check if music is going to work for this person.
Come again? I didn't get that.
Ma'am, how earlier you mentioned that music is not for everybody, right? So maybe you would assess like how music can help my client, or how is the music going to help?
Yes. So this is eventually we are talking about this only. How music is going to help. How music is going to help. We are eventually talking about this only. Initial assessment में it depends on the case. आपको रेफरल आया कहाँ से है? हॉस्पिटल में है तो आप उसका पूरा बीपी, पल्स रेट, रेस्पिरेटरी रेट, everything you will be taking those parameters also. And then the common thing in, generally we adults के लिए हम ये assessment करते हैं. We take all the parameters. The अभी BP pulse is so important. I keep one, BP device here also in my center, at my center, so that, I can constantly check if in case of adults, I do that. And then we have sleep, whether the sleep is good, how is the anxiety levels of the client. Then the pain levels again, even in the psychological problem, you might get body pains. And in every case, you need to know what kind of pains, mental pain or physical pain the client is going through. Then we also have mood swings, any kind of mood swings, anger showers, these days, these things are so common. So such things are taken into consideration. Then we have musical assessment. Musical assessment may we are primarily we are not going to judge our client. We are not going to judge any patient कि music, अरे इसको तो सुर ही नहीं पता है, इसके साथ मैं क्या गाऊं? No, we are not like this. We are going to work through his or her level of musical understanding. So we get to know, everything has to be very tricky, or I would say you have to be very smart asking questions, like what kind of music do you like? What time of the day do you prefer to prefer to listen to the music? What kind of music do you listen? What is your favorite genre? And Do you have any musical traditions in your family? Do you think that music, when you are in emotional pain, do you listen to music, right? Such things, or do you sing? From which device do you prefer to listen to music? Do you play any music? Do you have any family music tradition? Do you go to devotional? Do you see music in your family? Going to doing those kirtan and jagran things. वहाँ पे तो music practice हो रहा है. And what else? Then pitch and rhythm assessment. Pitch का assessment, rhythm का assessment. मतलब कि उसके सुर लय ताल का assessment हम करते हैं. It's not about कि उसको marks देने हैं कि हाँ अच्छा होगा तो अच्छी therapy होगी. No, it's about we have to design our session according to their musical preferences and musical inclination or understanding.
Ma'am, I have a question. Can I ask?
Yes, Jinu.
Ma'am, I want to know if there is a major problem, like major psychological disorder with persons like anxiety, major anxiety disorders, or major depression, or any other kinds of major personality disorder. So music therapy can help them, or without
Yes.
using. Okay.
Yes, definitely it works. It might work slowly because if you talk about severity of the disorder, generally, see, people are not going to psychiatrists. They are suffering there only because they are not aware. But if an aware client who is going to a psychiatrist, definitely music therapy can work with them.
Okay, ma'am.
Sometimes we see clients who have no interest in music, and sometimes, in case of depression, बहुत लोग हैं जिनको म्यूजिक सुनना ही नहीं है. They don't want to listen. They don't want to listen to people either. So there the process goes very slow. All right, then coming up to the next three staircases: setting goals, objectives, planning and implementation, assessment and evaluation. ये जो तीन चीजें हैं ये आप हर सेशन में करते हैं. As a therapist, you do this at every stage, and it's a simultaneous process, or it's like a cycle. Yes, Akshita. Yes.
Am I audible, ma'am?
Yes.
Yeah, so actually I wanted to ask if there is any standardized assessment for music, like we have for anxiety, for depression. Is there any such assessment for music as well?
Yes, we have. Actually, it depends on आपने कहाँ से music therapy course सीखा है. Because you will see different assessment forms. Even, globally also you will see different assessment forms. But yes, more or less, the things we ask or we get, we get informed are same, almost same. Right? जो मैंने आपको चीजें बताई हैं, almost यही चीजें हम प्रोफाइल में लेते हैं. Almost यही चीजें हम जो पेशेंट से जब हम पूछते हैं, we ask the same things, more or less. So standardized कह सकते हैं, but the forms are different. Like, the question might be in some other form, but you are ultimately taking out the information to plan your sessions. That is, जितना ज़्यादा information आपको client से मिलेगा, उतना ज़्यादा अच्छा है. Even beyond assessment forms. And one more thing, we are not going to, as a therapist, we are not going to share our assessment or the result of assessment with the clients. We don't share it. We only share the music therapies, the interventions. Okay, what kind of techniques do we use? So we have a wide variety of techniques and interventions used in music therapy. Like Abhishek can understand the power of songwriting, right? So songwriting is something we are doing professionally. मतलब musicians professionally करते ही हैं. We have professional songwriters, but music therapists are also songwriters. We constantly create music. I do it every day, especially जिस दिन बच्चे आते हैं ना, तो दो लाइनों के songs मेरे होते हैं. So that's how you have to create, and you have to be very quick in creating songs. Small song, very, very short songs. Okay, so this is one of the technique. But then if I talk about the receptive part of the music therapy, receptive music therapy techniques are listening. Listening is one thing. Then we have relaxation part, guided imagery and unguided imagery. Jahan pe you're not actively participating, but you are receiving the music or the whatever therapy you are being done with. So those are receptive music therapy. I use, I use all the things depending on the client. So it's, again, I said previously also, it's a client-centered approach. Very, very client-specific. एक गाना मैं आपको सुनाऊं 2 लाइनों में, आपको समझ में आ जाए म्यूजिक थेरेपी क्या है.
Ma'am, actually, I mean, my question was, like, I have come across a questionnaire that was Tom. I am forgetting the name of the publishers, but it is a test for music preferences, wherein there are different genres of music in the form. Like, the items of the questionnaire are the music genres, and there is a rating scale from 1 to 10. And the client or the whoever the subject is, they are supposed to mark the items as per as their preference. So that's what I'm asking. Like, are there any such measures
Yes,
to
we
assess?
have assessment forms. We use assessment.
Okay.
Yes, we are using. So primarily, I am using the assessment form which my institute provided. Right. So I cannot name any assessment form right now because I'm primarily using those assessment forms. Yes, we also do assessments on different scales. Also, we have different items, but primarily the one I said, जहाँ पे मैंने आपको म्यूजिकल प्रोफाइल बताया, इसमें हम सब कुछ कवर कर रहे हैं. फॉर एग्जाम्पल पिच की रेटिंग देते हैं, रिदम की रेटिंग देते हैं, बट देन अदर थिंग्स आर ऑलमोस्ट टिक्ड, मतलब टिक करते हैं हम उसको, रेटिंग नहीं दे रहे हैं. सो सम पीपल आर रेटिंग इट मे बी बिकॉज ऑफ द प्रेफरेंसेस की. हो सकता है कि उसको डिवोशनल थीम भी पसंद हो और हो सकता है उसको रोमांटिक थीम भी पसंद हो, है ना. तो so yes, it varies, but it's very much, the items are very much common. आप अपने क्लाइंट को म्यूजिकली आई वोंट से जज करें, बट आप उसको देख रहे हैं कि मैं हाउ डू आई फिट इन विद हिज सेशंस, राइट. तो मैं अपने सेशंस को कैसे प्लान करूं. तो यस, वी हैव डिफरेंट असेसमेंट फॉर्म्स, डिफरेंट टेस्ट, डिफरेंट स्केल्स, बट यस primarily we are talking about the, मैंने जो आपको कैटेगरीज बताई हैं, those are the things we are working on, और those are the factors जिसकी वजह से मैं अपना सेशन प्लान कर पाती हूँ. That's why we do assessment, isn't it?
Yes, ma'am, surely. Thank you, ma'am.
Yeah, so coming back to the song, 2 लाइनें हैं. पता नहीं आपने ये गाना सुना है कि नहीं. जो तुमको वो पसंद वही बात कहेंगे, जो तुमको हो पसंद वही बात कहेंगे. तुम दिन को अगर रात कहो रात कहेंगे, जो तुमको हो पसंद वही बात कहेंगे. What I mean कि हमें क्लाइंट के अकॉर्डिंग सुनना है, हमें क्लाइंट के अकॉर्डिंग अपने सेशंस को प्लान करना है, डिजाइन करना है, राइट. सो यू सेट योर गोल्स. फॉर एग्जांपल, यू माइट बी वर्किंग ऑन द सेल्फ एक्सप्रेशन, राइट. छोटे छोटे गोल्स भी हम लेते हैं सेल्फ एक्सप्रेशन में. आज मैं इस चीज पे बात, आई विल स्टार्ट वर्किंग ऑन दिस थिंग और दैट थिंग. I will start working on the social communication. I'll start with working with the intellect part, such things, cognitive part, or maybe. तो हम ऐसे काम करते हैं. Then जैसे आपका एक सेशन हुआ, अगले सेशन की तैयारी आपको करनी है. You have to plan and implement, plan then implement, plan and implement. So you are it's a constant process. You are constantly doing this. Then you do the assessment and evaluation through documentations. Documentation is a very, very important part, which sound healers are not doing, for sure, right? They are taking the case history, everything, but a music therapy session needs a lot of documentation, because without it you won't be able to survive. And yes, we were talking about the sound, the music therapy techniques. तो हमने receptive technique की बात की थी, और active techniques में क्या आ जाएगा? जैसे song writing, lyrics analysis, singing along. Okay, let's sing along. This is a YouTube video of karaoke. So what are karaoke's? So this is not something that I use for music therapy. Very, you know, with elderly clients, I'm using it. But this is one of the, you know, therapeutic technique, I would say. It's therapeutic, you know, for, you know, singing for yourself and for your daily practice of music. मतलब अगर हम गाना नहीं भी गाते हैं या हमें गाना नहीं भी आता है, we can easily sing with karaoke. Would you like to sing? All right, tell me if you can hear this.
Yes, ma'am, it's audible.
It's audible, or is it loud?
Ma'am, it's fine.
All right. So you can mute yourself and sing along with me. Okay. So this is, you know, Rag Yaman ka ye karaoke hai. We have 5 songs here, and this is one of my favorite karaokes. All are the old songs, but you will, I'm sure you will like it. कुछ old songs ऐसे होते हैं जो हमेशा, you know, evergreen होते हैं. तो इसको हम कैसे करेंगे? Basically, we are going to add our vocals to it. The whole music is already there, along with the lyrics. Okay. I'm just starting it. So Rag Yaman पे based है. Rag Yaman it's, I would say कि बहुत ही smart राग है ये. राग क्या होते हैं? These are combination of different notes. तो हम एक तो शुद्ध स्वर लगाते हैं, सा रे गा मा पा धा नी सा, जो हमने स्कूल में किया है, हमेशा हम गाते आए हैं. सा नी धा पा मा गा रे सा. These are the pure notes, right? But then if अगर एक भी नोट की हेरफेर होती है तो कुछ और बन जाता है. ठीक है, तो यहाँ पे म के साथ हमने छेड़खानी की हुई है. तो म जो है उसको चेंज किया है, म को तीव्र कर दिया, तो वो राग यमन बन गया. सारे गा मा सारे गा मा सारे गा मा सारे गा मा पा धा नी सा. Right? This is not a music class, but yes, just wanted to tell you there is some difference. So now we have got a mashup. कुछ पाकर खोना है, कुछ खोकर पाना है, जीवन का मतलब तो आना और जाना है. दो पल के जीवन से एक उम्र चुरानी है. जिंदगी और कुछ नहीं, तेरी मेरी कहानी है. एक प्यार का नगमा है. I hope you all are singing with me. तो अगर उदास होगा तो उदास होंगी मैं भी. तो अगर उदास होगा तो उदास होंगी मैं भी. नजर I hope you recognize the song. मैं पलकन डगर बुहारूंगा, तेरी राह निहारूंगा, मैं पलकन डगर बुहारूंगा, तेरी राह निहारूंगा, मेरी प्रीत का काजल तुम अपने नैनों में मले आना, जब दीप जले आना, जब शाम ढले आना. And that's the last song. मेरा ख्याल है अभी झुकी हुई निगाह में, खुली हुई हंसी भी है दबी हुई सी चाह में, मैं जानता हूँ मेरा नाम गुनगुना रही है वो, यही ख्याल है मुझे के साथ आ रही है वो शाम कुछ अजीब थी ये शाम कुछ अजीब. That is from my side. If you want to ask questions, मेरी PPT में और भी वैसे चीजें हैं. If you want to go through, these are it is basically you will get these are informations. Biological effects of music में क्या होता है, हम जैसे मैंने आपको बताया BP रेगुलेट करने के लिए, हार्ट रेट रेगुलेट करने के लिए, हॉस्पिटल्स में we do it like this. इम्यूनिटी बढ़ाने के लिए, yes, इम्यूनिटी बढ़ाने के लिए सप्लीमेंट्स के अलावा म्यूजिक भी यूज कर सकते हैं, बिकॉज हार्मोन जो हमारा डोपामाइन है, हैप्पी हार्मोन, और कॉर्टिसोल स्ट्रेस हार्मोन, ये दोनों कम ज्यादा होते हैं म्यूजिक से. यस, वी गेट स्ट्रेस्ड बिकॉज ऑफ म्यूजिक समटाइम्स, बट अगर सही तरीके का म्यूजिक आपको सुनाया जाए या सही तरीके का म्यूजिक बजाया जाए, तो you will see that there is an increase of dopamine levels, which eventually reduces your stress, improves your immunity, and reduces the chances of infections. So that's the logic is. And yes, relaxation, say muscle relief, tension tension release करने के लिए, muscles relax करने के लिए, pain management में music बहुत काम आता है. And that is all the therapy where the therapy lies, right? We are working on these things. Primarily, अगर आप जैसे बॉडी मूवमेंट्स और कोऑर्डिनेशन की बात करते हैं, तो यू विल सी स्पाइनल इंजरीज के पेशेंट्स कितने, वहां पे हम देखते हैं कि फिजिकल जो मूवमेंट्स उनकी नहीं हो पा रही है, वो म्यूजिक की वजह से जल्दी हो पाती हैं. देन मेमोरी एंड लर्निंग डायरेक्टली प्रोपोर्शनल टू म्यूजिक. एंड ऑफ कोर्स इंसोम्निया के पेशेंट्स यू विल सी अ ग्रेजुअल, मतलब आपको इतना इंक्रीज दिखेगा पिछले 2 साल में ही इंसोम्निया के पेशेंट्स, और जो कोई कॉमन स्लीप प्रॉब्लम होती है उसके साथ भी म्यूजिक बहुत अच्छे से वर्क करता है. Psychological effects of music, you just go through it. We have already covered these things. Self-esteem is something I think it works with everyone. So primarily मुझे लगता है कि singing and performing for yourself or for someone, it improves your confidence and self-esteem. All right, so I hope you are reading this, and I'll just quickly cover all these slides. Music therapy as mind body medicine. So we are working through these things, right? ये 4 चीजें हैं जिस पे सबसे ज्यादा work होता है, stress related disorders, psychosomatic disorders, behavioral disorders and emotional aspect of physical disorders. And इसके अलावा दूसरी diseases जो होते हैं. These are some glimpses. I'm not sharing any kind of hospital pics or clinic pics because it's confidential, not allowed to share. But these are some home session pics, and the first lady was 96-year-old. She's no more, and she was completely bedridden. But yes, with music, she started moving like moving hands, because वो कुछ भी move नहीं कर पा रही थी, तो eyelids move करना, eye movements, hand movements, that started with just giving shakers and playing and singing her musical preferences. Then the second and the third pic is of the same client who is now 9 years old. She's taking music therapy sessions since 3 years and 3 years now, and when she was 6 basically. So the guitar that I'm holding is her guitar, which I requested her parents to buy because I saw a great interest in this girl. So this girl was diagnosed with, at the age of 2 years only, she was diagnosed with global developmental delay. So you understand global developmental delay. Every growth is delayed. Speech, sitting, eating, moving hands, motor skills, everything is delayed. And now she could, of course, she's also taking other therapies. And music therapy is something, music works for her, with her very, very well. So, you have to see, you have to see over time, over a period of time, you see changes in your client. That's it from my side. If you have any doubt, please ask for another 2-3 minutes.
Ma'am, I have a doubt. Like you mentioned, ki music therapy also works in prison. So when we talk about prison, does it also work with children in conflict with law and children in need of care and protection too? And like in what ways does it help them?
आपने पहला कैटेगरी कौन सा बोला?
Children in conflict with law.
Conflict with law, and then?
Children in need of care and protection. How does it work for them?
I think I've not worked in this thing and I've never heard of it. But yes, wherever we need to give mental support, it definitely works. I'm sure it works. And I've never seen कि किसी बच्चे के साथ ये work ना करे. All kids,
like, ma'am,
in case of juvenile also, I'm talking about that also. When अगर आप counseling दे रहे हैं, तो why not, you can give musical support also. But again, मैं आपको यही कहूँगी कि मैंने अभी तक इस टाइप का केस कोई देखा ही नहीं है.
Oh, okay.
I've not been into such field.
Right. Okay. Thank you, ma'am.
Okay, ma'am, music plays a big role for children with special needs. Because I'm a special educator, I teach students who are specially able. There are very much musical songs which makes them calm and sit properly. So can you just tell me one thing? If a child is facing these type of issues like autism and these type of things.
Yes, yesterday only I, my client who is 5 years, moderately autistic, suddenly became very, cranky, and he wanted to, just relax. He was not liking whatever I was doing yesterday. Otherwise, he's good in, although he's not taking instructions yet, because it was just his 7th session. तो 7 sessions तो काफी है नहीं बच्चों के साथ, बहुत सारे sessions करने पड़ते हैं. But then it's a regular activity for them. But then yesterday only he got cranky, and after 10 minutes, he just lied down on my lap, because we spread the mat. We do the therapy for kids there only. And I just played some kind of, binaural beats. Binaural beats is, it's basically a sound frequency. I just played it. And with that, I vocalized my voice. Very, of course, to calm down. And he really felt good and became composed. That's what he needed for that session. Sometimes, especially in case of autism, this happens a lot. And really, it works. It really works. हो सकता है वो घर पे उतना ज्यादा काम नहीं हो पाए जहाँ जो यहाँ पे environment उसको मिला है.
Yes. The environment plays a major role. I just wanted just one help. Just some songs or some music, some beats that you can share and you can tell me that you can use these sounds to make them calm
Mm.
on YouTube, on any other.
See, if you think that you can vocalize, I mean, आप vocal music use करते हैं.
Okay. Yes. I can.
हाँ, अगर आपको लगता है, if you're confident that with a combination of instrumental theme and voice could do something, because सिर्फ pre-recorded music लगा देना is not going to give a permanent solution. For that matter, वो short term भी इतना काम नहीं करता, क्योंकि pre-recorded तो आप कभी भी चला के आप तो उनको लिंक भेज सकते हो YouTube के, isn't it? कि पेरेंट्स को I do that कि आप ये लिंक्स ओपन करके सुनाइए. Nowadays it's so simple कि आप तो YouTube का लिंक भेजना है, right? So honestly speaking, there are no specific playlist. Every music therapy has got their playlist, मतलब जिसको हम clinical terms में या फिर म्यूजिक थेरेपी की लैंग्वेज में हम रेपर्टोयर बोलते हैं. तो every therapist create a playlist, but then आपको कैसे पता चलेगा कि ये मेरे क्लाइंट के लिए सही है कि नहीं? Yes, लेकिन आपके केस में जो छोटे बच्चे हैं उनके साथ आप you can use rhymes, yes, but मैं अपने rhymes खुद बनाती हूँ. I'm creating songs. मैंने आपको बताया 2-liner songs I'm creating, but it's something very situational. For example, if I want, so this boy, 5-year-old autistic child, has washroom problems. Whenever he goes washroom, first of all, no communication, but he is gifted with rote learning, as we see in autistic kids. So he remembers all the songs and he sings very well. Nobody can say that, matlab full speech hai. Speech is very good.
Okay.
But then there is no communication, no hello, no asking for washroom, no permissions. Can I drink water? Nothing. Right? So we are working on those goals. So can you understand what I'm saying? I'm talking about that I'm creating a washroom song. I'm creating a I'm creating a clap song. So you will find clap and tap song on YouTube. That is very common. But what I'm trying
There's
to
also
say
a song of Minions Clap Your Hands by Pharrell Williams.
yes, and actually for such a small child who is not creating even sounds, मतलब वो गाना गाता है पूरा, but मतलब मुझे पूरा वो रघुपति राघव सुना सकता है. He can sing रघुपति राघव राजा राम. Then he is not ready to speak, communicate, right? So with what his speech therapist is doing right now is the basic vowel sounds, and it's hard to believe that a child who is singing proper songs, घर मोरे परदेसिया, ये ऐसे गाता है. He's singing like he's a miracle. He sings like this, and I'm sure he'll be singing much better after a few years. So things are very, very tailor-made. It's very, very customized. So music therapy sessions are like this only. It's not something that you are singing and other parties listening. No, it's not going to happen. It's very much, you need to create a bond with your client. Right? So I hope we had enough light on this topic today.